and then we'll go ahead and get started. We're going to let a few of your colleagues join us, and thank you for being on the call with us or on the webinar with us today. Okay, so it's 3:02 now, so I think I'll go ahead and get started. So again, welcome to the Choice Neighborhoods webinar on data partnerships. This is one in a series of webinars around data collection, performance measurement, and outcomes for Choice Neighborhoods planning and implementation grantees. And as I think you all know by now, my slide is not advancing. Okay. As you all know, my name is Marsha Tonkovich. I am a subcontractor with ICF and have been working with the Choice Neighborhoods program for about the last year now on thinking through their outcome measures and really how to describe the impacts of these important programs that you all are working on. I'll be joined today by Jessica Rosenberg and Esther Shin, and Jessica and Esther are going to both introduce themselves in just a moment on one of our upcoming slides. So let me talk a little bit about what we're going to cover today for the next hour. We're going to start with giving you a good idea of what a data partnership is, and you've heard a lot about partnerships as we have talked about Choice Neighborhoods over time. But this is a very special kind of a partnership with a particular purpose, and so we're going to distinguish it from other sorts of partnerships that you have and talk about the kinds of data that you're likely to ask those partners to collect and how you codify that data collection process in an agreement with those partners. And then finally talk about how you're going to manage and staff the data collection, data reporting function. So that's our agenda for today. Again, we do hope that you ask questions. We really want to make this interactive. So we will ask you to do one of two things. Please, and we really want to have folks jump in, so please raise your hand. And as an attendee, if you raise your hand, our team here at ICF will be able to call on you and unmute your mic and ask you to go ahead and ask your question via the audio. So if you're not joining in the audio, please do so. Or if you don't feel like asking your questions verbally, you can also use the questions box, and you can type in a question. And again, our folks at ICF will be watching that. So my colleagues at ICF, if you guys can watch both the attendees box for hand raising as well as the typed in questions, and let us know if we do have a question. And I'll periodically stop and take a break to make sure that we don't have it. So with that, I'm going to go to our next slide and give you a little sense of what this is all about. And for that, I'm going to turn it over to my friend Jessica, who's going to give you a sense of this webinar and what we're intending to do with the series.
Thank you, Marsha. Hi, everyone. Welcome to our webinar on data partnerships. My name is Jessica Rosenberg. I'm filling in for Alexa Rosenberg, who leads our performance management work here in the Choice Neighborhoods office. And we really put this webinar series together to share some ideas on how to incorporate performance planning into your work as early as possible, especially for our planning grantees, many of whom want to make this a part of your planning process early on in the early phases of your work. So if you're joining us for the series for the first time today, welcome. And you can view archived webinars that we've held 3 webinars before this at our HUD Exchange webpage, which we'll share with you through our newsletter and also at the end of this webinar. So today's webinar, as Marsha talked about, focuses on data sharing partnerships, and we have Esther Shin with us today to share lessons and advice from her on-the-ground experience with data partnerships. Esther is Senior Vice President of Planning and Policy for Urban Strategies. And Urban Strategies is a nonprofit organization with a lot of experience leading place-based human capital development strategies in public housing communities that are undergoing comprehensive physical revitalization. Urban has been engaged in this work for a very long time, for decades, including through Hope 6 and now through Choice Neighborhoods, and is working as the Choice Neighborhoods People Lead with 5 implementation grants currently. So Esther is responsible for coordinating social and economic strategies for these communities, with a particular focus on developing long-term sustainability of social service programs and partnerships, and providing technical assistance to community organizations. So you'll be hearing from Esther throughout this webinar. Please type in or raise your hand if you have any questions for her along the way. She's a great person to bounce ideas off of, and as in past webinars, your questions will really enrich this conversation over the next hour. So with that, Marsha, let me hand it back to you.
Great. Thank you very much, Jessica. And you'll hear Esther personally in just a few moments. As Jessica mentioned, what we're going to do, the way we'll walk through the materials for today, is we'll give a good sense of the concept or the options or some of the ways that we have seen this data partnerships work. And then I'll turn it over to Esther, who will give you an example of some of the work that they have done on that particular topic. And again, we encourage you to ask questions throughout. So let's first jump in with a conversation about what do we mean when we say data partnerships, because we talk about a lot of different types of partnerships in choice neighborhoods. And when we say data partnership, we mean something actually quite specific. So we're talking about partnerships between the choice neighborhoods recipient or the neighborhood revitalization organization lead and their partners in undertaking activities and in managing and delivering products and activities in the neighborhood, some of whom may get funding from you, some of whom may not, but all those partners together. This is about the data that you're going to collect from those partners and report to show your progress, to show your outcomes. And so it's not about working out that partnership of who's going to do what and what kind of activities we're going to do and all the things that you do also have to work out. It's not a partnership around the activities. It is specifically a partnership with organizations from whom you're going to collect data, and then you're going to report that data. And so you could have some people whom you're having a data partnership with who, as I said, are not getting funding from you, maybe have their own set of funding, but who are working in the neighborhood where you are working and where together you're trying to have that collective impact that we talked about in the last webinar, where together you have decided that you're going to try to create change in this neighborhood. And so they have their piece of the pie, you have your piece of the pie, but you both want to be able to show that collective impact. And so the data partnership is designed to share that information across those partners and be able to collect that data that you can then aggregate and describe what's happening in the neighborhood. So it's different than other kinds of partnerships that you've probably also entered into. For example, you have financial partners. So you have people who either fund you, so foundations who have funded you, or you have a grant agreement with HUD, or the state who might be giving you money, or you're giving money to others, right? You might have a subrecipient nonprofit whom you're funding to do housing counseling or something like that. So it's not a funding agreement. It's also not a coordinating agreement, which is you do have a lot of partners where you agree to jointly work together and you set out a set of joint goals and you decide what you're trying to achieve together and you talk about the roles and responsibilities of those partners. That's also important, but it's not the same as a data partnership. So again, the data partnership is exclusively and solely about the information to be collected, how it's going to be collected, where it's going to be collected, and how it's going to be reported. It's all about the data. So one of the things that people sometimes get confused about in the data partnerships is if you have an existing partner who is indeed a coordinator with you, who you're working together on activities, is that enough? Is that going to cover the data? And typically our answer is no. And it's because often the people who are going to collect and report the data are not the same people as who are going to be doing the activities or managing the organization with whom you're working. So a good example of this is your local police department. You may have a great partnership with your community policing office or your district local office, your local police office, or even with your central administration of your police department to work together in this neighborhood. But typically, most police departments, particularly in the larger medium-sized cities that are undertaking these kinds of activities, there's often a data collection, data reporting arm of the police force. And it's that data collection arm with whom you want to have this data partnership. So that may not be the same person as those whom you have a day-to-day relationship with related to addressing crime in the neighborhood. And you can see that there would be lots of different examples of where that would be true, that the data folks are different than the day-to-day folks that you deal with in terms of undertaking the activity. So we'd like to go ahead and do one of our early polls, and I think if you have been one of these webinars before, it's a chance to hear from everybody. So I'm going to turn it over to Chantel to go ahead and open up the poll. Okay, so You guys hopefully can see the poll now. So Chantel, I'm going to let you go ahead and recap the poll because I actually can't see it.
Okay, right now the polls are open and 41% of the participants have voted.
Terrific. So if you haven't yet voted, take a pick and let us know which one of these you think are the most challenging data partnerships to establish. Is it the school district, the police department, the health department, one of the universities, a nonprofit in your neighborhood? Okay, Chantel, so why don't you recap for us where we are on the poll and what we learned? And maybe show the poll with everybody.
Okay, we have 54% voted for the school district, 0% for the police department, 8% voted for the health department, 0% for local university college, and 38% voted for nonprofit service providers.
Thanks. So it's really the school district and the nonprofit service providers who I think are challenging, and we've heard this across. This is actually true, particularly the school district one. Is true. We heard it here across many of your colleagues. It's a challenging partnership to put together, often because the schools have their own set of requirements for what they have to collect, and they have rules and things that they have to follow. And so it is a challenging but very important partnership to develop. Thanks, Chantal. All right, so with that, I'm going to go ahead and turn it over then to Esther to lead us into our first sort of set of examples around the types of partnerships we want to create.
Great, thank you so much. So good afternoon, everyone. This is Esther Shen with Urban Strategies. The lessons that I'm going to share from the field are not the end-all, be-all. There are always other ways to look at some of these challenges, and a lot of sites have had some great success around developing data partnerships. These are just some examples from Urban Strategies experiences and our work that has evolved over time. So this first lesson for the field, what are typically the most challenging types of data partnerships to create? Two challenges that we have seen that particularly stand out. First is that data partnerships require a significant amount of capacity. And when I say capacity, it can be varying forms in terms of resources. It can be capacity, lack of capacity in terms of staff. It could be lack of capacity in terms of staff time, staff expertise, in terms of funding so that you've got the systems in place. An example is I worked with one provider who's a provider of low-level literacy, and they have been doing their tracking in Excel spreadsheets. And so their capacity to be able to track things real time was a real challenge because we needed the information quick. And so working through how to strengthen the capacity to be able to track data real time and in a format where a management system in a format that was more compatible with the information that we were trying to collect was a significant challenge, and one that was easily overcomable through some of this capacity building kinds of assistance. A second real challenge is politically charged data. When you talk about large systems like school districts, like police departments, oftentimes there's a fear of data sharing, developing a data partnership, because there could be a fear of negative attention. If the data doesn't show immediate success, if the data has shown decline over time, that might be information that your data partner does not really want to share. So some of the lessons that we've learned around these two challenges include clarity around the data collection expectations at the very start of your planning process. Data is critical not only to implementation, but as you plan, because it helps clarify what kinds of strategies you're trying to develop, who needs to collect the information, who has the information, and is the information even collectible. Then look really broadly at your potential data partners. So the public safety information, it could, again, reflect negatively on a partner. There are all sorts of other data partners within your community that you might not have necessarily thought of, whether it be a data information center, whether it be a university that could help you collect that data in a more neutral way that does not necessarily reflect poorly on your partner. Make the data be about building capacity and collectively finding solutions. So again, focusing on the public safety data. Make it about, going to your police department, saying, this collection of data is not about being punitive. It's about coming up with strategies that will strengthen your department for us to be able to go out and find resources together. Maybe there are foundations or public agencies that are willing to help strengthen the capacity of the police department to address some of these issues, and that this is not about making your police department look bad, but about strengthening and building your capacity. Next slide.
Thanks, Esther. And before I do, I'm going to just take a quick moment to see if we have any questions. Do we have any questions, folks from ICF? Any hand raising or anybody typed in?
There are no questions and no hand raised at the moment.
Okay, terrific. So again, folks on the phone, I just want to reiterate that we are happy to have questions throughout, and you can either raise your hand where you can see your name under attendees, or you can also, you have a little questions box on the bottom right-hand corner, you can type in a question as well. Okay, so let's move on and let's now talk about what kinds of data to collect. And so some of this we've been talking about over the last 3 webinars that we've talked together. And so I want to define what each of these are and then talk about how this relates to the data collection partnership that we're discussing today. So the first type, and we'll go in more detail about it, are baseline information. And that's going to be sort of the starting point. Where is the neighborhood right now? When you begin the project, when you begin the work in this neighborhood, where does it currently stand? And we'll get into more detail about the baseline. The second is demographic information, and we've talked about this, and we talked in previous webinars about the outcome measures. Demographic information is information about sort of the composition of the neighborhood. So it's things like race and ethnicity, and age, and income, and other characteristics of the people who live in this neighborhood. These are not necessarily things that you're trying to change or that you are trying to affect, but rather they're descriptors of who lives in this neighborhood and the characteristics of those people. That's different than the outcome data that we've been talking about over the previous webinars. Outcome data is, what is it that we affected? We said we were going to have this kind of an impact. Have we in fact had that impact? What are our goals and what have we achieved? So that's the change in or the result of your activities. And so outcomes are almost always expressed as an increase in or a decrease in, right? So an increase in children graduating from high school or a decrease in crime in the neighborhood. Because again, the outcome is what was your impact, what was your result. And then finally, the fourth type of information that you might collect is around the status. So where do we stand on the activities that we said we were going to undertake? Are we on schedule? Are we achieving the number of units we said we would achieve? So that's a status report. So all 4 of those types of reporting are important and could be part of your data collection process. We've talked about the others in the past, so we want to focus here a little bit on the baseline and why it's important and why it's one of the very first things we think you should do when you set up these data partnerships. So as I said, baselines are where you currently stand. And as I mentioned, in order to be able to measure outcomes, you're typically looking at a change in, a reduction in or an increase in something. And so in order to be able to measure that outcome, you have to know where you stand today. So in order to be able to do that baseline, and some of them are easy and some of them are hard, the first thing you have to do is figure out what outcomes are you trying to measure? What is it that you're trying to achieve? Don't try to start with the baseline and then back into the outcomes. Start with the outcomes and then say, okay, if this is what I'm trying to measure, what do I need to know about the data today? What do I need to be able to show as my ground floor of where I'm starting? And then think about those partners who can help you to document that baseline. So for example, let's say that one of your goals for your program is a reduction in crime in the neighborhood. So obviously in order to be able to measure that, you have to know what is the current level of crime, and you'd want to talk about that with your police department, and particularly the data folks at your police department. And your data partnership with those folks would want to have a component of give us the data about where the neighborhood currently stands on crime, and then periodically report to us on how that is changing over time. So you're going to find as you think about outcome measures and as you begin to think about reporting on how you're making a difference, virtually everything you focus on, virtually every kind of outcome, you're going to need to think about the baseline now. Think about it early, because it's very, very hard, 3 or 4 years from now to go back and establish how you've had a change or go back and think retroactively about the baseline if you don't figure it out right at the beginning. So with that, I'll turn it back over to Esther.
Thank you. So the questions of what are the challenges with collecting baseline information and selecting the kinds of indicators where you want to establish the baseline. This is an area that has really evolved a lot over time in our 40 years of existence. And when I say that, a lot of it has to do with the indicator and whether we're tracking bodies or impact. An example is like economic indicators and economic success. And when we originally started out in this work, when you look at Hope 6, for those of you that are familiar with Hope 6 data, a lot of the information that we were being asked to collect were what we called widgets. It's counting bodies, enrollment, program completion. So if you take a workforce training program and the indicator you're looking at or the metric you're looking at are the number of people that completed a program or enrolled in the program, your data partnership might be with that specific job training partner. But if you're wanting to look at impact, which is what a lot of the data collection has since evolved into, and you're looking at impact, and we want to look at things like purchasing power and the amount of wages a family is starting to earn and what kind of impact that has had on the household in terms of being able to buy. Your data partner may change. That data partner may now be looking at tax rolls, looking at the volume of, looking at the businesses in your community. Has the volume of purchase from local residents increased or decreased? So you might be looking at a different data partner based on what your indicators are and what they've evolved into. Some challenges that we have found collecting the baseline data include individual level data, such as school performance. And specifically, there are two challenging reasons for the individual data. One is confidentiality. There are all sorts of regulations around privacy, FRPPA, HIPAA data, so getting, for example, a school district to share individual level information about a particular a student's academic achievement score is going to be really, really challenging. So you might have to pick a proxy, and that proxy might be based on the number of students. If you've got a large number of students in your community that are going to one school, you might have to use that school's overarching academic performance data as a proxy for what you were trying to do with individual student level data. Another challenging set of data that's difficult to collect is data that's collected by zip code and not by neighborhood. This is often what you see with health departments or city health departments. So how do you go about getting more specific information about your community? One potential solution is that a lot of times your federally qualified health center or community health clinic is mandated by their funding streams to conduct a health impact assessment by neighborhood. And usually these are performed every 2 to 3 years, depending upon the particular funding stream for that health clinic. You might want to partner with that specific health center to get and collect the kind of information that you need around health specific towards your neighborhood. And then finally, really challenging data in terms of baseline indicators is self-reported data that's collected through surveys. Potential solution is getting a high number of residents or community members to participate. Self-reported data is always a challenge because you're asking a question and you don't know how trustworthy the answer is. You might get a very, very wide array of answers to a question like, how often do you read to your child 3 times a week? Parents might feel compelled to, because of judgment, to inflate that number based on actual. So then how do you go about choosing a question or survey information that is truly indicative of what it is that you're seeking? Then you really got to ask yourself, what is it that you're trying to do with that information? Is there really an added value to asking a question like, do you read to your children 3 times a week? What ultimately are you going to do with that information? Is there potentially a proxy that you could ask that would be more accurate? Or is there some more formal information that you can gather that would not rely so much on self-reported data? Are there any questions?
We do have one that was written in. So let me see if I can summarize it for you, Esther. The question is, do you have an example of a partnership with a school, district, or system that did permit sharing individual data? In other words, where you were able to get them to share that individual data. If so, how did that happen? Did it start as a more generalized data sharing agreement and then evolve into individualized data once that trust was established?
Actually, there are 2 really great examples, and they're San Antonio and they're Columbus. In San Antonio, in both of those cities, a lot of it, was an evolution, and a lot of it centered around community transformation. So the choice planning effort was really the impetus to start those conversations, and both have now since started implementation, and so that sped up the process of developing a data sharing agreement. But they were able to do this through some very, very specific controls on who had access to the information, who controls the data and the information. So there are only a handful of people in San Antonio that are ever allowed to see that data. So the school district made it very, very clear that this was not information that could be spread, that could be widespread. They also very much saw the potential opportunity to use that information and being able, and it was, I think, part of the carrot in both of these communities is that this data was then going to be connected to other community information. So, for example, Johnny is truant. Johnny has been truant 3 days this week. What else is going on in Johnny's family? So what's the other data that can be married up to the school data that could then help these schools, the principals, to be able to shape their after-school programs, their in-school programs to support Johnny in a way that truancy would then decrease. So the school district saw the data sharing as a much more significant capacity building for them to be able to shape programs that would then support all the kids in the community. Now, there are going to be some communities where you just can't get beyond this confidentiality issue. I know that some states have very, very stringent state FRPPA and HIPAA laws that just almost make it impossible. And so, what happened in San Antonio and Columbus, quite honestly, might not be legally possible in your community. But if it is based on state statutes, I think there are a number of different examples of how you can make it happen and demonstrate to school districts why that kind of sharing of data would be so critical.
And Esther, one of the things, I don't know if you all have done this as well, that I've seen people do when it's legally allowed, but yet there remain concerns with school districts particularly, is you have folks sign a non-disclosure agreement in that the data, the folks who are handling the data on your end will be the recipients of the data, the analyzers of the data, sign a written agreement that they agree that they will not disclose of the data at a personal level. They would, it'll only be shared in aggregate, and that they'll have proper storage and handling of that data. Have you seen anything like that as well?
Correct. So both Columbus and San Antonio, there are ironclad agreements that went through months and months and months of legal scrutiny between the housing authority and the school district. So all the lawyers from both sides taking very, very close look at the agreement to make certain that they were not in violation of anything. Also, what I've seen in other communities to add a layer and of protection is getting signed affidavits and agreements from parents that the sharing of information, that they're comfortable with the sharing of information as well.
And Esther, do you usually have the individual staff persons, or is it just an organization-to-organization agreement? The ones I've seen a couple where individuals who are handling the data also have to sign an individual non-disclosure agreement.
But yes.
Oh, that's what I thought.
Yeah.
Okay, terrific. Well, before I move on, I want to let other folks have a chance to type in a question. So anybody, Chantel, do we have anybody with their hand raised or any questions typed in?
No questions and no hands are raised.
Okay, so we'll keep going, but again, I want to encourage folks to jump in. All right, so let's talk about what you're going to be asking the data partner to do, and therefore how you codify that. So we're going to be asking that data partner to really collect and report information to you, and importantly, we need some understanding of what will we do if the data we are getting is either neither timely or it is not complete or it's not in the format that we need. So we need to have an understanding, which I think Esther just talked about having the details worked out of what it is they're going to report and what are the penalties or what are the actions in the event that it's not being done the way that it needs to be done. So where does all that all get captured? We've heard of folks trying to move forward on some of this without a formal agreement or putting it into other agreements that they already have about the eligible activities and the goals they're undertaking together. And our experience is that really is not the best way to proceed because it doesn't call out these data elements that you're looking for and doesn't draw enough attention to some of these very important issues that Esther just talked about, need to get hammered out about confidentiality and method of transmission of the data and how you store the data and all of that. So we recommend that you do sign an agreement or an MOU between your organization and whomever you're going to get data from. So you'll probably have multiples of this data partnership with each of those organizations who are going to report to you. And in that data agreement, you're going to call out the key things that you're going to ask them to do and how you're going to do it. And we'll talk about the clauses in just a minute. As I said, we do recommend that this not be put together with your coordinating agreement, your funding agreement, your partnership agreement, the other agreements that you may have with those organizations. Because, again, this is probably a different part of the organization, and even if it's the same organization, we want to draw attention and we want to have some very detailed, specific things worked out in this data sharing understanding. So what goes in that data sharing agreement or MOU? Obviously, first and foremost, it's going to call out the roles, and it's your role as the partner and their role as your partner, who's going to do what, and what is it that's going to be reported. And here in the section on what's going to be reported, you may not need to get down to the level of minutia of the specific indicator or the specific data element, although it could be your partner will want to call that out. You may just want to talk in general about the kind of data that's going to be reported so that if it changes over time, you have some leeway in your agreement. You do want to talk about the frequency. So are you asking for this data monthly, quarterly, annually? And again, you might be a little bit vague here, but you want to have enough detail in the agreement so that if things are not on time, you have a document to go back and point to say, hey, you said you sent it to us quarterly, we haven't gotten it for the last 2 quarters. You want to talk again about how the data is going to be reported. So in terms of what system, if you have a particular data collection system and you know that now, call it out. If you don't know the name of the system because you haven't decided yet, at least call out that there will be reporting in some sort of data system. We note that you might want to indicate to whom, and by that we don't mean a specific person. You don't want to call out, the data shall be sent to Bob Jones, because obviously Bob could leave the job. You want to talk about data being sent to a particular division or a particular title, so that there's clarity on where that information goes. We did just talk about the very important privacy policy. Your agreement wants to call that out, and your partners will certainly want you to have called that out. And I think Esther just mentioned this is often a subject of much debate about what is going to be those privacy requirements, and you will probably have to commit to certain obligations related to how you're going to store the data, who's going to have access to the data, and all of that. And then finally, you want to have a section on how are we going to address any changes to this agreement, whether it's for non-performance because the data is not being reported or it's being missed, or the quality's off, or if this part of your program is no longer relevant and you're going to cancel that agreement. You want to have all those logistics worked out. All right, so Esther, back to you.
So some things to consider before you're developing an MOU with a data partner. I'm going to repeat, some of the things that Marsha and I have both already talked about, that demonstrated that those are extremely important things to think about. First off, any legal obstacles particularly around things like confidentiality? And are there any organizational bureaucracies that you have to go through? Does this have to be approved by your board? Does it have to be approved by an executive from your leadership? Especially when you're considering things like confidentiality and ensuring that there is an ironclad agreement where only certain individuals are able to see personal information. So I get, clarity very, very much up front about what data is needed, how frequent the data needs to be collected, reported, how will it be used, who reviews it, making certain that in terms of collecting and sharing the information, those that are accountable, who's accountable, and who's responsible for what. Because what could end up happening is, if you have an MOU that doesn't have any dollars attached to it, because there are a lot of there's access to a lot of free data out there, then what happens if you're not able to get that information in a timely manner, or you get poor quality information? Which gets to my last 2 points is, are there resources you might have to pay someone, or you might have to pay an organization to share that information so that they've got the capacity to be able to collect and share that information in a timely way. And then, if you've got a group of organizations that are sharing their information for free, how do you do that quality management around that data and ensure that it's collected in a timely manner? One example I've seen in a couple of different cities is the creation of a data committee. This committee includes all the organizations that are providing you the major data sets. What I've seen is this group meets on a monthly basis. They troubleshoot, because sometimes the quality of the data collection might not necessarily be because your partner doesn't care, but because sometimes the specific indicator data that you've asked for is simply a challenge to get. So then you can collectively think through, maybe there's a proxy, how do you troubleshoot it, and then your partners are accountable to one another. They can see sort of the issues that are coming down the pipeline as in regards to data, and then you as a group can figure out the solutions. Are there any questions about this particular area?
We do have one question, so I'm going to turn it over to Chantel, who is working with the questions.
Yes, we do have one question. Is it better to have one master agreement with all partners that have data reporting duties, or multiple separate agreements? What are the pros and cons of each approach?
So I have seen master agreements from several organizations, and then what I've ultimately seen it evolve into is the need for separate individual agreements. If you've got some of the cons as it relates to master agreements with multiple different organizations is if you've got a challenge getting data from one entity. For example, I had a partner in one community where the data, it turned out, was not reliable at all, and we had to get out of that agreement. If you've got multiple partners attached to it, then it can create a number of different kinds of conflicts as you're trying to potentially add another partner. You get into sometimes some political ickiness. If you've got one partner out of the group that's not carrying the weight, then sort of terminating that particular component could become legally a legal issue. So if I had my druthers, I would always go with an individual, with just a singular organization having that data agreement so that you're very, very clear. Now, you could have a agreement amongst many, many partners on how those data partners work with one another, and not necessarily the specifics around confidentiality or whatnot, but if you've got sort of a partnership committee, how those partners work with one another, that you will agree to troubleshoot, that you're committing to the core reasons why you're sharing this information, something which is a little more superficial, but getting partners to understand how critical the data component is. Of that, I could see some benefit to, but in terms of the hardcore data sharing components, I think having one large agreement could potentially pose some legal challenges.
not only the legal challenges, but we talked earlier about having enough specificity in the agreement that we know what we're holding people accountable for. And if you have a master agreement with everybody, it either gets really long for everybody or you lose some of that specificity. And I think I would agree with Esther's point that you would be much better off to have an agreement with each partner. You could have a model, you could have a template that you then adjust, you tweak it according to the partner that you're working with, so you don't have to, have a lawyer draw up 12 different agreements. But, I think that there's certain things you want to have in an agreement with the school board that you might not have in the agreement with the police department. Are any other questions that we have? All right, seeing none?
No other questions.
Thank you. Okay, so let's bring up the next poll, Chantel. Okay, so the poll is open. So we have, question is, what's been the biggest challenge in implementing and managing your data partnership? And we have a number of different answers here. So pick which one you have found to be the greatest challenge. And again, I will ask Chantel to let us know what we learned. So please take a moment and vote for us. Okay, Chantel, so what do we have?
We have about 50% of the people have voted so far. 54, they keep rolling in.
And what's our result?
Okay, I'm closing it now. We have 7% voted at figuring out which partners we need, 40% at getting other organizations interested or involved. We have 13% voted the accuracy of the data they report, 27% the timeliness of their reporting, 13% at making sense of the data they send us. Most participants voted getting other organizations interested, involved.
And that's an overarching issue that we see in a lot of different aspects, not just around data, but certainly the data is the big one. So, that's something that maybe, Esther, you could say a word about how your organization has, built that interest, built that partnership, got everybody on the same page about the kinds of data we're going to collect and report.
So, this, I think, leads very much into the next section as well. When you're talking to like universities, there's definitely, there should be some sort of inherent interest. So you look, as the university is looking at community revitalization, it could be in line with their core mission of wanting to educate students, or it could be a research initiative for a university if it's in line with, say, a planning department. Now, in terms of organizations, again, I'll stress that if you can link it back to something that's capacity building for the organization, that this information sharing will in turn benefit your organization. I think that that's another way to another potential carrot. Like the school district example, being able to share the data, gather information from other partners to improve how you're doing your own work. And then potentially funding. If you could demonstrate that as a collective body that this sharing of data will help inform how, as a collective, as a partnership, we're able to improve on our work, there might be some funding dollars to it. And if you can very early on find a funding partner that's interested in this kind of systems work, then sharing that data and collecting that data might be more appealing to a group that is challenged with resources.
Great. Thanks, Esther. Okay, so let's go ahead and now talk. So we talked about the type of agreement, and we talked about the kinds of data. Let's talk about who and how you do it. So one of the things that we've heard in the earlier webinars that we have done is a lot of questions about how do we staff this function and how do we pay for it and who does it. And so we've seen a lot of different models for how people have approached the data collection function. You could, if your funding permits it, hire specific data collection, data analytics staff. So you could hire new staff with the kinds of expertise around data reporting, who are great at sort of how you lay out reports and who you're great at analyzing data. And some of your colleagues at the implementation grantees and at some of the Promise Neighborhoods grantees have in fact hired one or two staff people whose job it is to focus on the data and the outcome measurement. If that's not possible or not the way you want to go, another option is to take a look at your existing staff people. and figure out whether there's someone on your existing staff who can take on as part of their responsibilities being the head of data collection, data reporting. Now, one of the heads up about this, and we've talked about this quite a lot among ourselves, is does it really work to take someone who's already busy, who has a full-time job doing other things for you, and now add data collection on top? And obviously, our experience is no. You know, if you want to take existing staff people to do it, you then have to realign their duties, because if you don't give the data collection the time that it's going to require, and there's a certain amount of trying to get the data from your partners and then make sense of it, it probably won't get done or it'll be delayed. So while there is an option, which is to assign existing staff, you have to think about how it fits in with their existing workload. You could also contract with a partner, and this has actually been a pretty popular way to go. You could find a community college or university, state college, who has professors and students who are interested in data analytics, who are interested in helping as part of your community efforts in this neighborhood, particularly if it's a university in a neighborhood where you're functioning. And you could contract with that university, or you could also look at a nonprofit who does similar sorts of outcome measurement kinds of things, maybe a foundation in your community, and have that partner, their job is to act as your data bank, to act as your data resource. And they collect your data, they report your data, and they work with you on the data. And Esther will talk in a moment that model has been done quite successfully with a number of Choice Neighborhoods grantees. And then finally, you could look around your partnership, and you could say, okay, well, maybe we as an organization, maybe we're the housing authority, and we don't have the time or the resources or the expertise to do this kind of data collection and analysis, but our city partner does. So assign it to my city partner, or vice versa. Or maybe the school district is already doing all of this, and they'll take it on for the whole partnership. So you could look at an existing partner and assign that job to a partner if they're willing to take it on. So we'd like to have you guys type in for us, if you could. Go into your questions box and type in the answer to which of any of these, or if you have a different answer, how have you decided to staff your data function? Are you hiring? Are you assigning within? Are you going to do a contract with someone? Are you going to assign it to a partner? Or do you have a different model altogether? So go into your questions box and type the answer, and I'll ask Chantal to kind of read out what people are saying. Let's just take one moment and let you guys type in. Again, you're in the questions box and you're typing your answer. Okay, so Chantal, are we starting to see answers typed in?
Yes, we have 4 so far.
Okay, so why don't you read off what we have so far?
Okay, we have assigned contract with partner, parentheses, case manager. We have assigned to existing staff, hire new staff member, hire new staff and assign to willing partner.
Okay.
And we have assigned to existing staff, contract with the university.
Okay, so it sounds like we have all of these models across all of you, and none of them are right or wrong. They're all different approaches, and you can certainly combine, as we heard a couple of people saying they were doing. So that's great. It's good to have that sort of broad brush of different things that people are doing. So with that, I'll go back to Esther and ask for you to give us sort of what you have seen working out there as you've worked with communities.
So as Marsha said, the university partnership model I've seen be very, very successful around the country. If you're comfortable with the university potentially taking that information and maybe doing some research around it, if there's no discomfort around that, if you could come up with some mutually beneficial research goals, then a data partnership with the university can be very, very low cost and sometimes free, as they've got students that can assist them and assist in terms of data collection and managing and tracking that information. A second example that I've seen in a couple cities is this data committee with the critical data partners. And this is a committee that is oftentimes staffed with data experts, not necessarily programmatic experts, but data experts that understand how to collect some of the really, really complex data sets. What data sets are actually feasible to collect and what's not feasible to collect. An example is median household income, which at one point I'd seen as a potential metric for Choice Neighborhoods, and until a data expert said you can't get that information. So having data experts on a committee, they can help you sort through what's feasible to collect, what's not. And then finally, finding a resource partner very, very early in your process, whether it's a philanthropic partner or a corporation or a business that might have some interest in looking at how certain systems work in your community and where data might be a great influence. An example is in one community I worked in, there was a foundation that was particularly interested in how the justice, education, and supportive services community was supporting disconnected youth, and how was youth getting lost in the system, and how can sharing data potentially improve how services are provided for disconnected youth. So this particular foundation supported funding a data system for all of the organizations involved, so that was some significant capacity building, and then funded an individual data expert to be able to support all of these organizations, integrate their information, be able to collect that data so that it wasn't an undue burden on these organizations that were focused on services. So identifying an early funding partner that has a particular interest in systems that might be able to give you greater capacity and fund some innovative ways to be able to collect this data. Are there any questions?
Yeah, so let's open. We have a few minutes left before the webinar closes out, and we have one last closing slide. So before we close out, I'd like to hear from attendees. If Chantel, do we have anybody with a hand raised or a typed-in question?
We have one hand that is raised.
Great. So can you unmute that person?
Bernadette, can you have the ability to speak?
Bernadette, can you unmute yourself? Can you, Chantel, can you unmute Bernadette?
I did unmute her.
Okay.
Bernadette, you can also use the question box if you wanted to ask your question that way.
Oh,
okay.
Thank you.
Oh, hi, Bernadette. How are you?
I didn't really have a question. I guess I hit that button by mistake, but thank you very much.
Okay, well, thanks. All right, anybody else, any questions? All right, well, before we close out, maybe I'll ask Jessica or Karen or any of the folks at HUD, anything you want to add before we close out?
This is Jess. Hi, everyone. Thanks so much for joining us. I just wanted to, I guess, two things. One is to remind folks that we have a best practices guide up on our website, and we can get the link out to all of you who have participated. That focuses on Seattle, which is an implementation grant, and their education partnerships. And as part of that, there's also a PDF of one of their data partnerships with the school district. So I thought that could be an interesting example, especially for the large proportion of folks who talked about education partnerships being one of the most difficult data partnerships to establish. And I guess just given that, although Esther, you've talked a lot already about partnerships with school districts and other education partners, just wondering if you have any sort of last words of advice or ideas for how folks can kind of save time or learn more about some best practices around those partnerships if you're trying to get individualized data for students from schools.
So I would say that include these institutions that could potentially be your data partners very early in the planning process, because as you put things together like your community survey, as you think about metrics to track success, these are the organizations that are potentially going to be providing you with significant amounts of data. If they're involved in the beginning of the process and understand why the data is being collected, what is the story, and a lot of times they could probably tell you what the story is behind the data, then you're probably going to end up with clearer sets of metrics that are truly going to measure the outcomes that you're trying to achieve, rather than simply pulling metrics that feel like they're going to measure what you're trying to succeed, that feel like they will measure what success looks like. And then these partners will also be more likely to want to share this information with you if they know what it's for, what the end result looks like. I think including these potential data partners in the planning process is extremely, extremely critical, especially when you're talking about entities like school districts and police departments who have historically seen transparency in data oftentimes as the potential to be punitive, when this is really an opportunity to build capacity and share in the development of strategies that will benefit everyone.
Thanks. And I have one last question. I know we have 2 minutes left, so this will probably be a quick one. But just in terms of like the operationalizing of this, so say you have a partnership with a school, and you've got a great partnership with that principal, but he's not the person that's going to provide you the data. Going back to one of the earlier slides that Marsha talked about how your coordinating partner might not be the person in that kind of system or organization that provides the data. How do you go about finding that person, and do you use your coordinating partnership, your strategy partnership, to help you find and locate the right department or person that can help with the data sharing?
Yes. And so a few different things. So this whole honesty, being open upfront about what you want the data for. Oftentimes, you're like the chief academic officer knows who that person is, who you need to be connected with, and are really eager to get you connected to the person if they see that ultimately it's going to help them too. Now, if you're working with a principal for that very, very specific school, sometimes it might take a minute, but oftentimes it's the chief information officer. It's not necessarily that school principal. Most school districts have a chief information officer. That's usually the person that the principal or the chief academic officer is going to direct you to. Now, the agreement might ultimately be signed between the superintendent and the lead of your organization. In terms of actually looking at the data and see what you can collect is going to be an information type person.
Thanks, Esther. And I think that's probably a similar, you can take a similar logic with other departments besides just schools, right? You'd have a similar sort of data person or chief information officer and a police department. Perhaps if you have a health system in the neighborhood, that kind of thing, similar sort of person that you want to be able to connect to via probably your partnership that you have. So with that, I'm going to go ahead and close out. So thank you for joining us today. There's one more webinar left in our series, and that is around the data systems and sort of the processes and tools that go with those systems. So literally the IT and other information systems that you might collect. So if you have any follow-up questions to any of these webinars, as we've said before, please reach out to your HUD team coordinator. You can always email me. My email is here. Please feel free. And that next webinar is July 14th. So we hope you'll join us. You will get an email about signing up for it. And lastly, you will get a survey at the end of this webinar asking for your feedback on whether you liked it, what you liked, what you didn't like, and equally importantly, what would you like to see for future sessions. So please let HUD know if there's other topics, if you found these to be helpful, or if there's other sorts of technical assistance that would be useful to you. So with that, thanks to our folks from HUD, to our panelist Esther, and to all of you who were able to join us. Thanks again, and please let us know if you have questions.